everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to discuss with a very interesting as well as a very important topic in our profession. That is the nurse and the patient relationship. This nurse and patient relationship is a basic requirement in the nursing practice. Why? Because if we have a good nurse and a patient relationship, then we will find encouragement when we are feeling down, and it will also serve as a comfort when we are hurt. This nurse-patient relationship is very, very important. Here, a nurse who is skillful will use this holistic approach in order to provide care for their patient. So now let's move on to the definition of this nurse and patient relationship. It is defined as the interaction between two people in which a nurse offers a series of purposeful activities and practices that will be useful for a particular patient. So this nurse-patient relationship is defined as a relationship in which there will be an interaction between two people, that is the nurse and the patient. And here what happens is that this nurse will be offering, a series of purposeful activities and practices which they will be able to perform for the betterment of the client. If you are able to maintain this good relationship, then it will help you to provide care in an efficient manner, as well as it will also help the patient to regain back their health as earlier as possible. We have one more definition which states that it is an interaction process which helps the nurse to fulfill the role of her professional skills in such a way that it enables her to help the patient physically, mentally, socially, as well as emotionally. So now let's move on to the characteristics of this nurse and patient relationship. The first one states that it is an intellectual as well as an emotional bond between the nurse and the client, and is mainly focused on the client. So this nurse and patient relationship is very, very important. As I've said that, in this relationship, the nurse will be playing a major role in order, to help the client regain their health as soon as possible. So during this relationship, there will be an intellectual as well as an emotional bond between the nurse and the patient, but here the patient will be the person for whom this nurse-patient relationship has been started. The whole process will be focused on that particular patient in order to help them regain their health. It respects the client as an individual. How? By maximizing the client ability in order to participate in decision making. So in this relationship, even though the nurse is the person who will be taking care of the patient, but here what happens is that she will not be the only one who will be deciding. Here what happens is that there will be a decision making from both sides, be it from the nurse or be it from the patient. Here what happens is that before any decision is being made, the nurse and the patient will be having a conversation on which, they will be deciding on what plans is to be followed and what is to be left out. It also considers the ethical as well as the cultural aspects. So here, as we all know that, each and every person is different. Each and every person believes, values, ethics is different. Here, as a nurse, you must make sure that you must respect whatever the client's cultural as well as ethical value is. And we should also consider the family relationship as well as values. So here, how can we respect a client? We can respect the client by talking to them generously. We can also respect them, by considering their ethical as well as their cultural aspects, by considering their family relationship, as well as by maximizing their ability in order to participate in decision making. Now, moving on to the third one. It respects the client confidentiality. As a nurse, it is one of our important role and responsibility that we must respect the confidentiality of the client. As a nurse, you must make sure that we should not spread any information about the client, to another person. So here, the patient, if you are able to maintain a good relationship between you and the patient will, be comfort in order to self-disclose themselves, and they may, share all the information about themselves. So here, as a nurse, you must make sure that, you get all these information as well as maintain a confidentiality of it. And the next is that it emphasizes on the client well-being. So as I've said, that this nurse-patient relationship is a relationship between the nurse and the patient, and is usually focused on the patient, right? Why? Because here this nurse-patient relationship is started and is even maintained in order to promote the well-being of the client. So here this relationship is usually emphasized on the client well-being. And the last one here is that it is based on the mutual trust, respect, and acceptance. So here this nurse and patient relationship will only be effective if only, there's a mutual understanding, there's mutual trust, respect, as well as an acceptance from both sides. So these are the various characteristics of a nurse and patient relationship. This nurse-patient relationship is also known as a helping relationship. Why? Because here, as I've again, repeatedly been saying, that this nurse and patient relationship is a bond between the nurse and the patient, and is usually focused on the patient, right? So why here a nurse is involved? A nurse is involved in order to help the patient, in order to guide them, on what are the various things they need to follow in order to regain back their health. So what a nurse is doing here is, her role is that she is helping the client. That is why this relationship is known as a helping relationship. So during this relationship, there will be a discussion, there will be a decision making, there will be a mutual goals which will be set between the nurse and the client in order to promote their health. In order to develop this nurse-patient relationship or this helping relationship, the following points are important. The first one is to listen attentively. As a nurse, you should make sure that you should be an active listener. Here, this is one of the major role of being a nurse. Here, the patient, whenever they communicate anything or whenever they share any information about themselves or about their disease condition or about the treatment which they are undergoing, you should make sure that you note down everything and remember each and every, sentences that they say. You should also help to identify what the person is feeling, what the client is feeling. In this way, if you understand what are their feelings, what are the emotions, then you can help them, you can comfort them, as well as you can reduce their strength. You should also be able to empathize the patient. If you are able to put yourself in their shoes, then only you will have a clear understanding of what the patient is going through, what are their feelings, what are their emotions, and in this way you will also be motivated in order to help them more. And the next is, you should always be honest. As a nurse, you should always be honest. You should never lie, you should never exaggerate things. Only if you are honest, then you will be able to build a mutual understanding as well as trust between you and the patient. As a nurse, you should also be aware of the cultural differences. So before you treat the client, you should be aware of what are the cultural beliefs, what are the thoughts, what are the values, so that there will not be any problems that can arise, and also so that the patient or the client will be feeling comfortable. You should also maintain the confidentiality, as well as you should know your roles and limitations. You should never cross the limitations which is set in order to maintain this nurse and patient relationship. So this is what the helping relationship or the nurse-patient relationship is all about. Now here, moving on to the types of relationship. Here there are three types of relationship: the intimate relationship, the social relationship, as well as the therapeutic relationship. So what do you mean by intimate relationship? Here, this relationship is a feeling of emotional closeness as well as connection with the other person. So if you feel that there's an emotional bond, emotional connection with the other person, then this is known as an intimate relationship. For example, a relationship between a husband and a wife is known to be an intimate relationship. Here, there are four types of intimacy: the emotional, the mental, the spiritual, as well as the physical intimacy. Now, moving on to the next one, that is the social relationship. So this is a type of relationship that occasionally meets our needs and may lack the closeness as well as the interdependence of a personal relationship. So this type of relationship is usually common between co-workers or between distant relatives. So as I've said, intimate relationship is a relationship that, a person feels that there is an emotional bond, an emotional closeness, emotional connection between he and the other person. Whereas in this social relationship, what happens is that here the person will lack the closeness as well as the interdependence of personal relationship, and this relationship will also occasionally meet the needs of the other person. Now, moving on to the third one, that is the therapeutic relationship. So, this therapeutic relationship is usually a relationship between the healthcare workers and the patients. So, these are the three types of relationship: the intimate relationship, social relationship, as well as the therapeutic relationship. So, here you guys might be having a confusion, right, between the social relationship and therapeutic relationship. So, in order to clear this confusion, let us look at the difference between the therapeutic as well as the social relationship. As I've said, that therapeutic relationship is a relationship that happens between the healthcare worker as well as a patient. Whereas this social relationship is a relationship that usually happens between the co-workers as well as with the distant relative. Here, this therapeutic relationship is a planned relationship. Why? Because as I've said that this is a relationship between the patient and healthcare worker. So this relationship starts as soon as the patient comes to the hospital, and it also ends as soon as the patient leaves the hospital. Whereas this social relationship, it just happens with mutual interest. So if there's a mutual interest, then there may be a bond which can be formed between these two people. The main objective of this therapeutic relationship is to help the particular patient recover from their disease condition, whereas this social relationship has no objective. As I've said, that this is a relationship which will be formed based on the mutual connection or understanding, right? So in this relationship, what happens is that there will not be any objective. This relationship is set in order to have fun or to satisfy the needs of the other person. This therapeutic relationship is planned for a specific time and only for a specific place. So here, as I've said, that this starts as soon as the patient comes to the hospital. So here, it starts from when the patient comes till she leaves, and it is also meant to maintain in the hospital. Whereas this social relationship is not planned. There is no, planning for any timings or any place. It can happen anywhere and everywhere. The length of this therapeutic relationship depends on the purpose. So here, as a nurse, what is the main purpose of your profession is to help the client regain back their health, to help them cure from the disease condition. So this therapeutic relationship, this nurse-patient relationship will only last until this purpose has been met. Whereas in the social relationship, what happens is that the length of this relationship will vary, and sometimes it is also a non-ending one. In therapeutic relationship, the time period is limited, whereas in social relationship, there is no limited timing. Accountability is shared between both the people. And here the next one is that the nurse is fully accountable for their actions as well as activity. Whereas in social relationship, nobody is accountable. It depends on the values as well as the beliefs which, both the person is having. If these beliefs, these values are different, then this can affect the acceptance of the social relationship. In therapeutic relationship, the nurse accepts the patient as here and now without any discrimination or judgment, whereas in the social relationship, sometimes there may be judgment, there will be discrimination between both of them. In this therapeutic relationship, termination is a most important part. Why? Because this relationship is only meant to be maintained in the hospital. So as soon as the patient needs to leave the hospital, then this relationship will also come to an end. However, in social relationship, it can also exist for a very long period. However, there are times when it will suddenly, or it can also gradually end, but this depends upon the two person with whom this relationship has been maintained. So now here we have come to the end of this topic. So in today's session, we have discussed about the nurse and patient relationship. We have discussed about the characteristics of this relationship. We've also discussed about why this nurse-patient relationship is also known as a helping relationship. Then we've also discussed about the three types of relationship, that is the intimate, social, as well as the therapeutic relationship. And at the end, we've also discussed about the difference between the therapeutic as well as the social relationship. So I hope you guys have got a clear insight of this topic. Thank you.